And local health officials calming fears after the first case of the dangerous Ebola virus is confirmed on U.S. soil. Good evening. Thank you for joining us. I'm Mark Allen.
I'm Marcia Baumhart. Health officials releasing new information late this afternoon saying an error during the man's first visit to a North Texas hospital potentially put even more people at risk of contracting the deadly virus. The hospital first sent the patient home with only a prescription for antibiotics. Now, as fights for his life, a medical team from the CDC is working to prevent the disease from spreading.
Now, here in the Miami Valley, health officials say at this point the likelihood of an Ebola outbreak here is extremely unlikely, but still Rob Sneed is asking questions about how local hospitals are preparing for the worst.
There's unlikely to be an uncontrolled outbreak of Ebola in the U.S.
And the likelihood of it coming to the Dayton area is also slim, Dr. Tammy Lundstrom says. She's the chief medical officer and infectious disease doctor with Premier Health. And like many health facilities all over the country, Miami Valley Hospital has a plan in place should an Ebola outbreak happen.
What all the hospitals are geared up to do is to quickly identify any patient that may have Ebola.
Dr. Lundstrom says the hospital's reaction is based on the patient's symptoms.
It really causes problems with the blood clotting. People get headache, they get fever, nausea, vomiting, and then just organ deterioration and bleeding.
She says the patient will be asked if they have traveled recently out of the country, particularly a country in Africa where the virus originated.
Those symptoms coupled with travel to an area where Ebola is out of control. And that would result in immediate isolation, private room, gowns and gloves, etc., while we spent the time trying to sort out, do you have Ebola or do you have something else?
A blood test must follow to determine if the patient has Ebola, which generally takes about 1 to 2 days to get results. Dr. Lundstrom says getting a positive result doesn't always mean a death sentence as it would in other parts of the world. Here in the U.S., healthcare facilities are clean and up to date with the latest technology. She says that, combined with experimental drugs and the body's ability to fight off disease, helps make a difference in recovery.
It's something that you recover to, and even some of the experiments they're doing are taking antibodies from people who've recovered from Ebola and trying to use those on actual Ebola patients to try to help them get better.
The hospital has no set time for the patient's treatment or recovery, but Dr. Lundstrom says once the patient is healthy, they're free to leave isolation. Now that we know what Ebola is, coming up in the next half hour, hear how the virus spreads from person to person. Reporting in Dayton, Rob Sneed, 2 News, working for you.